So hello everyone and welcome to day 2 of the National Patient and Family Engagement Learning and Action Network Patient Summit. We are excited to bring you another day of exciting programming led by the ESRD National Coordinating Center Patient Subject Matter Experts. Together with our partners with the ESRD networks and the Centers for Medicare and Medicaid Services, we are able to deliver next level patient experiences with partners that illuminate patient voices. We're going to kick off today's summit with Melissa Dorsey, the Deputy Director for the Division of Kidney Health in the CMS Quality Improvement and Innovation Group. Melissa started her federal career in 2011. She brings 18 years experience in community health, project and program management, and in-depth working knowledge on how to improve and operationalize population health through promotion of continuous quality improvement activities that impact Medicare beneficiaries nationally. Prior to joining CMS, Melissa worked directly with patients affected with chronic diseases, providers, and their care family members in a hospital, federally qualified health centers, nursing homes, primary care providers settings, and localized community-based settings that include homeless shelters, community centers, and churches to improve quality of care, learning, and education. Melissa holds a master's degree in healthcare administration from the University of Maryland and a bachelor's of science in community health education from Morgan State University. Welcome, Melissa.
Thank you. Thank you for having me. And welcome to day 2 of the National Patient and Family Engagement Learning and Action Network, also known as NPFE-LAN Patient Summit. As Jerome just mentioned, I'm Melissa Dorsey, the Deputy Director of the CMS's Division of Kidney Health. The NPFE-LAN Patient Summit is a biannual event that provides practical information to help patients understand and live with kidney failure. The Patient Summit also provides an opportunity for healthcare leaders to come together and learn effective strategies and share best practices that will improve patient care. The summit also allows us to really tackle on some of the most pressing topics that impact patients and caregivers living with kidney disease. Now, yesterday, we heard from patients and caregivers like Jimmy and Don Bates, who also were a part of our 2022 CMS Quality Conference that we had earlier this year. So it was a pleasure seeing them and hearing from them again, as well as hearing from Mr. and Mrs. Moore from Alaska, as well as other healthcare leaders in a variety of topics. Now, in fact, we've received a live and close-up look at what it's like to treat with home dialysis modality yesterday. We also heard from patient subject matter experts, also known as our patient SMEs, with the NPFE-LAN. They shared with us resources that are developing to help patients who suffer from depression, learning more about home dialysis and transplant options. So also learning the benefits of flu and pneumonia vaccines and reducing their emergency room visits. And we ended our exciting day yesterday with a lively cooking demonstration of a chicken pasta dish from the 2-time transplant recipient, Chef O. Today is going to be just as lively and interactive. We will learn about the benefits of accepting a less than perfect kidney, get tips on how to protect ourselves from COVID-19, the flu, and monkeypox. And we'll end the day with tips on how you may address health equity at your organization. Now, the NPFE Patient-LAN Summit was created after listening to our patient stakeholders. This is a summit where the patient and the family advocate voice drive the conversation. Our goal is really to ensure that the patients and the providers really have the opportunity to learn best practices and give you a voice in creating solutions to treatment access barriers. Our work is not done until each and every kidney patient has the answers they need. With our exceptional patient leadership, strategic collaboration, and uniquely innovative approaches, we will continue to impact lives and give patients an opportunity to live their best and quality life. So on behalf of CMS, we thank you so much for joining us today and look forward to another successful day. Thanks for having me.